Society Bites Radio. I'm Steve Ryan for the Coastal Progressive and Rainbow Forum, bringing you topics of interest for the progressive and LGBTQ plus communities. Today we have MARCI MELZER, and MARCI has got a long history and great credentials in the area of speech pathology. And I'm going to let her give me a little bit about her background here. She was educated. She has her M.Ed in Speech-Language Pathology from the University of Virginia, and she has been interested for many years in out-of-the-box intervention methods, challenging cases. And MARCI, please tell us a little bit more about yourself and about why you got involved in your line of work here.
Okay, well, thank you so much for having me on the show, and I really appreciate the opportunity to share what I do. So I am actually an intuitive speech and language pathologist, and like you said, I was classically trained as a speech language pathologist and therapist, and I worked in the field for 29 years before I realized that the systems, the healthcare systems that provide speech therapy are challenging and frustrating for not only the clients, the kids, and the families that the systems are designed to serve, but it's also frustrating to be a clinician and work in those environments. And when I had the opportunity to sort of share my alternative way of working with families, I jumped on the opportunity to share what's going on with it. So instead of actually doing the therapy with the children, what I have learned is that parents are the best language facilitators. And the natural language learning that happens with children that parents and children sort of naturally have, there's actual systems in our brain that are designed to learn and teach language between parents and kids. And the current systems are very quick to label children with diagnoses to get them into systems that take them away from that natural language learning. And so the systems that the government and that insurance companies are paying for are actually potentially harming children and delaying their progress. And so that's why I use a different way of talking.
That's excellent. And can you, what led you, okay, I know this is a different area kind of for me to be doing interviews on, but I noticed here one of the areas that you were discussing was, as example, parents try to make kids talk by withholding their favorite things and making them say words. Comment on that a little bit and explain what this is about.
Yeah, right. So what usually happens with kids who are late talking, and I talk about my, all kids who are speech delayed as late talking because they're just not talking yet. But what commonly happens when kids get to be 2+ years old and they're not really using words to communicate, they're using other things to communicate. So if they're not, able to ask for, water or a cookie or things that they want, they're using other things like reaching, pointing, dragging their parents around. And usually parents get to the point where they realize that the kids are actually having difficulty with saying words, and they're looking late talking, and they're starting to use all these other behaviors. So parents learn, usually from therapists or a lot of the things that you read online, that if you withhold an object or make a child say a word in order to get the things that they want, that they'll actually start talking. And it's true that that happens. In fact, it's one of the fastest speech therapy tricks to get kids to say words. But what I have learned is that if there's a difference between teaching children to say words to get what they want and actually teaching them the words that they have inside of them that they want to say. Because whenever we teach children to say words, we're teaching them to say the words that we want them to say. And what I have found is that when parents give up these, the work of trying to pull words that they want to hear from their kids, and they shift to seeing the world from their child's perspective and interpreting those nonverbal communication behaviors, the pointing, the dragging you around, those kinds of things, and they drop the pressure for kids to start to say words, kids actually talk faster. And that's one of the things that, in speech therapy often happens. The speech therapist sends the parents home with the same strategies that work in therapy for the therapist, but they backfire at home, because at home the kids already have these alternative communication systems going. So that's, I guess, one of the biggest messages that I would have for any parents out there listening who have late talking children, is that if whatever you're doing with your child doesn't feel good to you, if it feels like you're having to pressure or pull or make your child say words, you're actually potentially blocking the natural verbal speech and language development that parents normally teach their kids by trying to be like a therapist. And so what I train parents to do is to give up all of those prompting and try to use, because parents usually guess what their kids want anyway if they're not talking. It's how they, figure out what their kids want in life. And if they're not using words, but they are using behaviors, parents get in the habit of understanding and interpreting those behaviors, and nobody really teaches the kids the words to represent those behaviors. So that's what I coach parents in how to do. I train them in how to look at the world from their child's perspective and use and model and demonstrate the words that they believe are actually in their child's head instead of the words that they want their child to say. Does that make sense?
Yes, and I'm understanding a little bit better now. Listen, give me some examples of, some of the unusual or extreme cases that you've been through, and this is examples of what you look for, and do you work with any of the children on the autism spectrum?
Yeah, so that's a great question. Actually, like I said earlier, when I talk about children as being late talking, that just means they're speech delayed, but it can be any reason that they're delayed. So most of the children on my caseload, or of the parents who I work with now, do have autism diagnoses. And even if they haven't received an autism diagnosis, parents have told their kids that they might have autism. And that's one of the things that is really broken in our system right now, because what happens is there are insurance programs and government programs that pay for therapies to target kids with autism. So parents actually try to get their kids diagnosed with autism to get these free therapies. But the reality is, and what parents need to do, is understand what it was that actually caused their child's late talking. Because autism is a spectrum disorder. You can have mild autism or severe autism, but there are many, many things that look like autism. In fact, one of the most common things that I see of children who are misdiagnosed with autism are kids who have ear infections and ear fluid, which is a very common thing to happen to little children. And when they aren't using words because they can't hear very well, they start to use other behaviors, and they appear to be very autistic-like, because they might have, pressure in their head from the fluid, and of course they're late talking, which is the number one red flag identifier for autism. And because there is no blood test for autism, and most autism diagnoses are given by checklists, and kids with examples like with ear infections, for example, show a lot of those checklist behaviors, they get the autism label. So what I tell parents whenever they, say, do you help children with X, Y, or Z problem, what I usually say is that there are really only a few criteria that are necessary for a child to be able to learn speech. So instead of looking at what's wrong, because I have used this method with children with, yes, on the autism spectrum, but also children, who are older, who are 5, 6, 7 years old, who have autism diagnoses, but also children who have brain disorders like an absent corpus callosum. I have other children who have a history of tongue tie and ear, nose, and throat, lots of allergies and things like that were the causes of their late talking. And once the child feels better from their physical illness, or the parent learns how to interpret what the child, is going on with them and what they know how to do, then there, like I said, are only 3 criteria for a child to be able to make improvement using what I call language facilitation from their parents. And that is that the child has to, the first one is the child has to want to communicate something. And the second one is that the child has to be able to understand basic language to learn from their parents. So a lot of these kids have really good receptive language and they can understand things and follow directions. They just don't have the ability to use verbal speech. So the child has to be able to want to communicate things, be able to learn from parents, and their ear, nose, and throat systems need to be working properly. So a child can't learn to talk if they can't hear well. So just the physiological systems of their mouth and their throat need to be working. But it doesn't even matter if there's a neurological problem behind this. No matter what level your child is, even if they're nonverbal, staring at the wall, rocking all day, you can find a way to reach them where they are and teach them how to come out into their world, start to use the verbal speech that's already going on in their head, and share it with the world. And I've been able to do that with 50 families, Steve, in 10 countries all over the world. No matter what's going on with their kids from 2 years old till 10 years old, and I don't even see the kids. All I do is look at video of what's going on in the family's household, identify what's causing the child to be late talking, and then I instruct the parents on changing their teaching and changing their modeling, eliminating those, like I said, those withholding things, those prompts, those making their kids say words, and show them how to have fun with language, and go back to how little babies and toddlers learn how to learn language from their parents in a real age-appropriate way for wherever they are with their child. And it's been remarkably beneficial and helpful. In fact, like I said, every single parent, no matter what's going on with their child, no matter how old the child is, if they're over 18 months old, their parents are getting them talking way faster, like 5 times faster than I ever did as a speech therapist. In fact, the older kids, Steve, are starting to say more words within the first week of their parents doing this language facilitation.
Excellent.
Yeah.
So you work with other foreign people in other foreign countries then too. And with VI video.
I do.
Yeah.
Yep. In fact, that's how I've been able to do it. And I've shifted my, the world of speech therapy is kids going to offices to see a therapist at a clinic, or the therapist going to the child's home and, working with the child while the parent watches or whatever. And what I have found is that, parents spend so much more time with their children that they, when they learn the right strategies and how to have fun, they can facilitate language while they're driving in the car, while they're getting dressed in the morning, while they're having a bath, while they're having family dinner, how kids normally learn from their parents. And the strategies are remarkably beneficial. And like I said, not just in one language, because the families who are abroad that I work with, I have a family who lives in Australia, but they're from Bangladesh. So their home mother tongue is Bengali, and their late talker is learning to